With spring break travel in full swing, there's an increase in flu and measles cases in children, and that has many parents wondering how to have safe and healthy vacations. Fox 4's Dionne Anglin got answers from an infectious disease specialist at Children's Health. Hi, Dionne.
Hi there, Clarice. Well, as families head into the spring break week, for many that involves traveling, while health officials are concerned about this seasonal surge in respiratory viruses.
Eager to enjoy spring break, adults, kids, and college students are boarding planes and hitting the road, bound for gatherings and crowded destinations. Health experts, meantime, are concerned about the possibility of an unwelcome guest illness.
We are still seeing flu and RSV cases, even though it's mid-March. So we're seeing a late tail end to those seasons as we're approaching spring.
Dr. Zachary Most of Children's Health in Dallas shared insight Tuesday on our Fox 4 streaming show, The Post. He says the uptick is attributed in part to close contact, packed flights, long car rides, and busy tourist attractions. During the week of March 8th, the Children's Health System recorded higher than typical numbers. Rhinovirus, 357 cases. Influenza, 150 cases. RSV, 106 cases, and 24 patients with COVID-19. Dr. Most says taking precautions is key.
Making sure that you stay up to date with routine vaccination recommendations regarding flu and RSV and COVID-19. And making sure when you travel to pack hand sanitizer, fever-reducing medications, fluids to make sure that people can stay hydrated in case your kids get sick, and potentially masks if you're worried about being in a crowded area.
While it's clear spring allergies are also prevalent, it's important to be concerned when and if symptoms persist or worsen.
Viral infections are really common, and the vast majority of them won't require any medical attention. So some signs to look out for when you might want to reach out to your doctor include whether if there's a fever that's been going on for more than 4 days, any fever in a child who's less than 3 months old, if there's difficulty breathing or trouble breathing, if your child is getting dehydrated and is so dehydrated that they're starting to have fewer wet diapers or not making tears, or if they're very lethargic or very tired, difficult to arouse or wake up.
Now, again, Dr. Most pointing out a good idea is to check with your physician for recommendations on vaccines based on where you're traveling. And again, wash those hands.